Assalamu alaikum friends, my name is Muskan, a microbiology student from GCU Lahore. Today we will learn about antimicrobial resistance. Microbes, also known as microorganisms, are the smallest living thing we know. They are everywhere. They are in the air we breathe and the soil we walk on, and they are even inside you as well. Majority of microbes are the part of our normal flora. However, some microbes can be harmful and cause serious infection. Antimicrobial drugs are used to prevent or treat infection caused by harmful microbes. There are four specific types: antibiotic, antiparasitic, antiviral, and antifungal. The key discoveries of antimicrobials are nystatin in 1949, the first antifungal treatment; thiabendazole in 1961, the first antiparasitic drug; idoxyruidine in 1963, the first antiviral drug. Early antibiotic breakthrough. 1940s. Penicillin was introduced and initially proved effective against many bacterial infections. Resistance emerges in 1950s. Bacteria like Staphylococcus aureus resistance to penicillin, leading to methicillin adoption. Multi-drug resistance rises late 20th century to present. Organisms such as MRSA and CRE appeared due to antibiotic overuse and global spread. Antimicrobial microorganisms such as bacteria, virus, fungi, and parasites. Antimicrobial resistance occur when microorganisms change over time and no longer respond to medicines. There are some causes of antimicrobial resistance: misuse and overuse of antibiotics, taking antibiotics without any prescription. Second one, incomplete treatment courses. Stopping antibiotics early allows resistant bacteria to survive. Third one, use in animal and agriculture. Antibiotics used for animal growth pass resistance to human. Lack of awareness and education. Poor hygiene and sanitation helps resistant microbes spread. Weak regulation. Easy access to antibiotics without control. Mechanism of antibiotic resistance. First one, inactivation of drug. Bacteria produce enzymes that chemically modify or degrade antibiotics. For example, beta-lactamases break down penicillin. Second one is change modified drug target. Bacteria mutate antibiotic drug target sites, preventing antibiotics from binding. For example, DNA guidase mutation and RNA polymerase mutation. Third one mechanism is reduced drug entry permeability. Bacteria alter their cell membrane to limit antibiotic entry, especially in gram-negative bacteria. Fourth one is efflux pump. Bacteria use efflux pumps to actively expel antibiotics before they can work, contributing to multi-drug resistance. There are different types of antibiotic resistance. MDR is multi-drug resistance, XDR extended drug resistance, and pan-drug resistance. Multi-drug resistance bacteria shows resistance against representatives of at least 3 groups of antibiotics. Bacteria show sensitivity against 3 groups of antibiotics. Pan-drug resistance, it is the resistance against all drugs. There are some consequences of antimicrobial resistance. Longer hospital stay, infection become harder to treat, use of broad-spectrum drugs, for example carbapenems. Increase economic burden, increase mortality rate, threat to modern medicines, for example chemotherapy. Longer hospital stay and higher medical cost. Simpler infections become harder to treat, for example pneumonia and urinary tract infections. And in use of broad-spectrum drugs, increase the survival of resistant bacteria, kill both harmful and beneficial bacteria. Prevention of antimicrobial resistance. Take antibiotics exactly as prescribed. Stop using antibiotics for coughing and sneezing. Safely dispose expired and unused antibiotics. Good hygiene should be maintained. For example, washing hands should be practiced remotely. Limit antibiotic use in livestock animals. Vaccine should be prioritized in humans because it prevents against infection. Raise awareness through education and campaigns. Awareness message and WHO slogans. First one, use antibiotics wisely, preserve their power. Second, spread awareness, stop resistance. Handle antibiotics with care. Fourth one, prevent resistance, wash your hands. Thank you.